Welcome. In this video, I'm going to be discussing types of appointments, so different doctor's appointments that you might need to make. The first is called a consultation visit. A consultation is your first meeting with a new doctor. So if you're calling to make an appointment and you are a new patient, you can ask for a consultation visit and explain that it is your first time. At this visit, the provider, who could be doctor, nurse practitioner, physician assistant, will discuss your medical history, ask about general health concerns that you have, and you get to ask them about their approach to medicine and their beliefs in treatment. And usually no treatment is given yet. This is just a time for you and the provider to get to know each other since you're a new patient. The next is an annual checkup. Annual means yearly, once per year. So an annual checkup is a regular visit you have once a year when you are healthy, okay? We often think of this for children, but this is important for adults too. The doctor checks your overall health. You get measurements like your weight, blood pressure, heart rate. Your provider may order basic blood tests to check your overall health, and the doctor might recommend preventative care, okay? Things to help you not get sick, such as vaccines, okay? They may recommend a shot while you're there. So this is an annual checkup. You may also hear annual physical. They are the same thing, the same type of appointment. I feel like everyone knows sick visit. Okay. A sick visit is when you go to the doctor because you don't feel well. If you call your office and say, I'm looking to schedule a sick visit, they know that you are looking for an appointment very close to right now, like today or tomorrow. Okay. So they will probably ask you to describe your symptoms. What's wrong? How are you feeling? The doctor or provider will examine you. They'll take a look at everything while you're there. They may give you medicine or a treatment option right away. And this visit is usually focused on one specific problem. It's not looking at your whole body or your entire health. It's looking at what feels wrong at this appointment. Okay, that is a sick visit. A follow-up visit. Follow-up means after, okay? So a follow-up visit happens after treatment or a previous visit, okay? Basically, this is an appointment that your doctor or provider tells you to make so that they can check and see if you are getting better. If you've had surgery, if you've had a procedure, if you've changed medicines, they will ask you to schedule a follow-up appointment. They just want to check in with you and make sure you're doing okay. So the doctor checks to see if you are getting better. You will both discuss if this new treatment or new medicine is working. The doctor may make changes if needed. And this visit is usually fairly short. It really is just checking in and making sure that your health is improving based on any changes you've made together. Discussing test results. Okay. This appointment is for reviewing medical tests. So your doctor will explain what your test results mean. This can be results from blood work that they've done. It could be looking at images, MRI, CT scan, X-ray. And this is where you will learn if there's something wrong, if they see something not good in any of these results. Your doctor will also recommend the next steps. What now? And you can ask questions about your results. Make sure you understand what they've learned about your health. Okay? But this one is called discussing test results. An emergency visit is for a serious or sudden health problem. Also, usually when your regular doctor's office is not open or available. So this would mean that you would go to an emergency room at a hospital. You don't need an appointment. You just go in. However, you need to know that doctors treat the most serious cases first. Okay, so if you go in with a broken arm, people with chest pain or head injuries will get called to see the providers before you. You may wait a long time, especially here in the United States. Also important to know that it costs more than a regular doctor appointment. Visits to the emergency room, even with insurance here, cost more money than a typical appointment at an office. So if you need to go to the emergency room, go. This is just information for you to know. A vaccination appointment is for getting shots to prevent illness. These appointments are usually very quick. So maybe you call your doctor's office and say you just want to come in, you need an appointment to get your flu shot. Then they know they can schedule you a very fast appointment. It's usually very quick. Depending on what you need or want, they can do one or more vaccines. The nurse or doctor that gives the vaccine will explain possible side effects. For example, after this shot, you may feel tired, okay? And they may help you schedule your next vaccine if it's a shot that you need to get on a schedule. Okay? And a referral appointment. This is when your regular doctor or provider is going to send you to see a specialist. Okay, so you need to see a doctor who's an expert in a specific area. Your regular doctor will send all of your information first by computer to a new office, to the specialist, and then you meet with the specialist to focus on this one specific health issue that you have. You might need approval from insurance for this visit. Many insurance companies require that your doctor give you a referral, say that you need a specialist, and then they will pay for that appointment. Okay? And I do have a worksheet. Let me take a look at this. I will show you the worksheet. You may just enjoy practicing some of this online. Okay? So here, if you'd like, you can practice matching up the types of appointments with their names. Here's a fill in the blanks where you can use the information in this video to complete what type of visit each of these people need. Here's a true or false where you can read through and see if a statement is correct or incorrect based on what you've learned. You can also write your own dialogue. You can make a conversation between you and the health office based on one of the types of visits we talked about today. That's one really good way to practice using this vocabulary. And finally, you can look at these multiple choice questions. It gives an example of a scenario, and then you would pick A, B, or C based on what you've learned today. Thanks so much for watching this video.